Hello everyone. Today we will be explaining to you about providing patient-centered care to children. Hopefully this resource helps you become more competent pharmacists and improves your confidence in being able to communicate to children with a patient-centered approach. This is an overview of the learning objectives that you will be able to apply. We'll be going through understanding what patient-centered care means, understanding how to approach providing patient-centered care to children, and strategies that can be implemented. You'll also learn the benefits of providing patient-centered care to children. Lastly, we'll finish off by confirming what you have learned from this video. Understanding what patient-centered care means. Patient-centered care involves delivering healthcare services that are mutually beneficial among healthcare providers, patients, and families. It emphasises involving and informing patients in their care, allowing them to actively participate in their medical treatment with close cooperation from medical professionals. Patient-centered care focuses on treating patients respectfully as individuals and not as conditions to be treated. This core value results in achieving safe, high-quality healthcare, contributing to better outcomes and experiences for patients, carers, and families. There are 7 interrelated attributes found in high-performing person-centered organisations. These include comprehensive care delivery, measurement, technology and the built environment, partnerships, governance, people capability and culture, and purpose, strategy and leadership. Understanding how to approach providing patient-centered care to children and the strategies that can be implemented to achieve this. As a pharmacist, there are key aspects we should consider when providing effective patient-centered care to children. For example, demonstrating a holistic approach to healthcare that doesn't just involve treating symptoms of a disease, but employs the engagement of therapeutic techniques inclusive of psychosocial factors, spiritual, emotional, social, and cultural. By employing cultural competence, patients are given the opportunity for self-expression regarding decision-making in their healthcare. Additionally, adherence of culturally different children and families is likely to increase, which integrates another key concept, meaningful patient-provider relationships. Shared decision-making, health literacy, and patient empowerment are all imperative overlapping ideologies in relation to patient-centered care and creating meaningful relationships. In order to express patient empowerment, pharmaceutical outcomes must be sufficiently explained to a child and their family, allowing for shared decision-making when discussing the child's treatment. Additionally, as the patient becomes more aware of their condition and has confidence in using their recommended medication, the final construct of health literacy is subsequently fulfilled. Patient-centered care is a difficult construct when working with children as there are several barriers to optimising it, both from the patient and pharmacy. The main patient barrier affecting patient-centered care of children is the absence of the child at the pharmacy when seeking healthcare advice. For instance, without the child's attendance, the pharmacist cannot directly observe the patient's symptoms or conduct counselling to create meaningful relationships. This results in unshared decision-making, which in turn impacts health literacy of the child. Essentially, this may cause a decline of adherence to the pharmacy if the product recommended to the absent patient was unsuccessful in treating their condition. Additionally, parent attendance may be a barrier to providing effective patient-centered care. For instance, if a teenage patient presenting symptoms of a sexually transmitted disease entered the pharmacy with their parent to seek medical advice, they may conceal information to protect themselves. One of the main pharmacy barriers for effective patient-centered care in children may be a lack of experience conversing with diverse age groups of children. The ability to adapt to distinctive levels of intelligence and maturity in children is imperative in creating meaningful and trustful relationships with them and their family. 5 key strategies for implementing effective pediatric patient-centered care includes encouraging the child's presence at the pharmacy, training pharmacists in how to communicate with children, fostering a child-friendly pharmacy environment, access to private counselling areas, and implementing interactive activities for children in the pharmacy. This can all be achieved by interprofessional learning between healthcare professionals. Understanding the benefits of providing patient-centred care to children. Patient-centred care provides a number of benefits to both patients and providers. In the short term, children may overcome their fears of pharmacies, consequently enhancing the reputation of the pharmacy. Additionally, a child at ease allows for the process of explaining medications and understanding a patient's situation much easier for the pharmacist. In the long term, patient-centred care ensures improved health outcomes and increased compliance, as well as positive patient-pharmacist relationships, which are found on positive principles like learning and trust. Let's put some of the strategies and concepts we learned into practice. Here we have an example of a child presenting to the pharmacy with their guardian. First, remember to foster a child-friendly environment. A simple strategy is to acknowledge the child, make eye contact, smile, and use a pleasant tone. Having an open and welcoming expression is ideal for fostering a positive response in children. They are much more likely to interact positively with someone who makes them feel comfortable. Actions that could make a child uncomfortable should be avoided, such as loud voices, an unpleasant demeanour, or a stressful environment. This is the first step to creating their trust in you, which is essential for a successful patient-provider relationship. Remember to also keep in mind cultural differences. When working in a pharmacy or hospital environment, you are likely to come across individuals from a plethora of backgrounds. Cultural differences are inevitable, and showing respect for those differences is imperative when developing positive relationships and providing patient-centred care. Upon receiving the prescription, you see that these medications are for the treatment and prevention of asthma attacks. See if you're able to demonstrate to the child how these medications are used. It's important that before you speak to the child, you receive guardian consent. If the guardian agrees with this, the best place to provide the information would be in a private counselling area. This ensures that you're valuing and respecting the patient and their family's privacy, as well as giving you more time to get to know the patient. It is beneficial to explore the patient's medical history as well as lifestyle and family factors, as they may alter the advice you provide. Providing proper counselling to children on their medications becomes an important aspect for patient-centred care, as it helps improve the child's health literacy. This increase in confidence and compliance with medications will result in improved health outcomes as children better understand why they are using their medications. To do this, you need to make sure you are confident with the medication and medical condition and deliver the information in a simplified way to suit the child's maturity and intelligence level. Back to our example, when explaining to the patient and guardian the correct usage for the asthma preventers and relievers, it would be important to use a language that is appropriate to the child to ensure comprehension. This involves using simplified terms and explaining more complicated terms. Extra learning media can also be very useful in this endeavour, as children tend to respond better to colourful diagrams and visuals rather than in-depth written and verbal communications like many adults. Engaging both the patient and the guardian is key. Remember along the way to ask if they have any questions or concerns. By doing this, you can help fill in any gaps in their understanding. When demonstrating how to use a device, encouragement is key. It's also important to remember that every child is unique and may require other methods of learning. Finally, before they go, you can provide some additional resources that can help in the continued and appropriate usage of their medications. Fact sheets for kids, as well as simplified diagrams and electronic resources, can help to remind both children and their guardians of what you have explained to them. Using these strategies helps improve your delivery of patient-centred care, allowing you to see benefits in improved compliance and improved health literacy among children. Not only that, you're also promoting a trusting relationship where the child will be more inclined to ask you for medical advice in the future, because you've taken time to help them and shown that you care. Going over what we have learned. Hopefully now you have learned what patient-centered care means and have appreciated its key concepts. By implementing and adhering to the strategies you have observed today, your demonstration of patient-centered care towards children in your pharmacy is likely to improve. We hope that by improving patient-centered care, there is a mutual benefit seen between patients and healthcare professionals. Thank you for listening, and we hope you enjoyed our presentation.